dear all. Yes, thank you. Hello, welcome to the webinar of Who Am I and Professional Identity Formation of Students' Engagement and Educational Development Unit of EDC from Tehran's University of Medical Sciences. For this 1 hour webinar, we have Professor Elizabeth Kachur from New York and dear Dr. Mahnaz Mortazavi as well, and they will tell us about professional identity formation. I want to introduce a little about the Professor Kachur. She is PhD and FAMEE Director and Medical Education Development Global Consulting in New York. And dear Mahnaz is a PhD candidate of History of Medicine from Tehran University of Medical Sciences. We have 1 hour to speak about the professional identity formation and about the importance of that. And please, if you have any question or comment, type in English in chat box, or maybe raise your hand to ask your question or share with us about your opinion and comments. Now I want to ask, dear Mahnaz, could you please start the meeting, and then we will have Professor Kachur as well.
Okay, thank you, dear doctor. Hi, everyone. And first of all, let me share my files. Please tell me, is it okay or not? Yes, yes. Okay, very good. Thank you. Good morning. Good good evening, everyone. Thank you for the opportunity to speak with you today. And the question, who am I, is really important. And today we are going to talk about it. I'm Mahnaz Mortazavi, PhD candidate of History of Medicine. And today I'm talk about this topic very short. And after that, we go through the presentation of Dr. Kachur. Okay. Very good. As you know, the question "Who am I?" is one of that we all grapple with at different times in our lives, but it has profound significance in the context of our professional journeys. Today, I want to explore the concept of professional identity formation and what it means to be continuously shaping our identities in our careers. First, let's define what we mean by professional identity. Professional identity is how individuals see themselves in a professional context, influenced by their experience, values, the skills, and the environments in which they work. It encompasses not only what we do, but also how we perceive our role within our profession and the impact we have on others. As we progress through our careers, our professional identity evolves. It's shaped by our education, the roles we adopt, our interaction with colleagues, and the challenges we face. This evolution is a vital aspect of our, sorry, I think is some problem. Let me check it. It's good. And the challenges we face, this evolution is a vital aspect of our professional development that facilitate not just personal growth, but also enhances our contribution to our field. And now, why is professional identity formation important? There are several reasons. The first one is clarity and direction. A well-defined professional identity gives us clarity about our goals and aspirations. It helps us understand our strengths and weakness, guiding our decisions and actions in our careers. Next one is enhanced collaboration, understanding our professional identities as well as those of others, foster better communication and collaboration. It allows us to appreciate a diverse perspective and work more effectively as a part of a team. The third one is adaptability in our rapidly changing world. The ability to adapt our professional identity is crucial. Those who are flexible in their identity are better equipped to respond to new challenges, technologies, and role that emerge in their fields. And the last one is the sense of belonging. Having a strong professional identity can foster a sense of belonging within a community to organization. It helps us find our tribe, connect with like-minded individuals, and build supportive networks. Next things is about the professional identity formation typically occur in several stages. And the number one is explorations. This is the initial stage where we gather information about various professions, seek in internships and engage in network. We ask questions like, what do I enjoy doing? And what are my values? Next one is commitments. In this stage, we start committing to a specific path or role. We make choices about our career directions and being to define ourselves within a profession. Next one is reflection and revision. As we gain experience, we need to regularly reflect on our paths. Are we still aligned with our professional identities? Should we pivot or refine our roles? And the next one is integration. At this stage, we fully integrate our professional identity into our personal identity, allowing us to present ourselves authentically in the workplace. And as a conclusion, professional identity formation is a dynamic and ongoing process. As we navigate our careers, we continuously ask ourselves, who am I? And seek to align our personal values with our professional roles. By remembering and embracing the journey of identity formation, we not only enhance our own careers, but also contribute positively to our professional and communities. Remember, it's not just about the destination, it's about the growth and the connection we make along the way. Thank you for your attention. And I hope this discussion sparks some thoughts about your own professional identities. And if you have any question or insights to share, I love to hear them. Thank you.
Thank you, dear Mahnaz. Thank you for your presentation. And now I want to ask Professor Kachur, if is it possible to start?
Sure.
Yes.
Yes. Hello, everyone. I'm really very honored to be here to share with you some additional thoughts about professional identity formation. Um, we already heard a very good summary of what the key issues are in this area, and I hope I can add a few more details. But I also hope this will be very interactive, and we have some poll questions, and also I hope there will be an opportunity, several opportunities for you to share your thoughts. And so please, throughout, feel free to put things into the chat and also hopefully share your video and speak up. This is meant to be a very interactive session. So let me start with sharing my slides, and I hope this will work. Can you see the slide? I'm going to just hide the floating meeting controls and turn on the, okay, what happened here?
Yes,
Sorry
we
about
can.
that. It went all the way to where it was before. This is the first slide. Can you see it?
Yes, yes,
Okay, excellent.
yes, that's great.
Yeah. So who am I? It's a question we all have to ask. As your previous speaker already mentioned, it's a process. It's not something that happens overnight, but it's something that is really a lifelong situation. And I'm talking to you from New York City. This is our agenda. We'll talk about professional identity formation a bit more, and then comparing the personal versus the professional identities. We'll talk about training impact on PIF, and then about some facilitators and barriers. Really, the previous speaker already mentioned quite a lot, but I hope we can deepen this discussion in the next hour as well. So let me start with inviting you all virtually to New York City. This is Broadway, the theater district. And a few weeks ago, I had the pleasure of watching a very interesting play. It starts out with this. This is the first thing that you see on the stage. You can read it. I can't because I can't read Iranian. But this was a play called English. And it was written by an Iranian American who was discussing the issue of learning another language and the identity transformations that will occur. Her statement is that it will occur. So it's a TOEFL class, a class where people learn English, some for various reasons. But it throughout the play, it describes how, or it demonstrates how people experience that change from Farsi to English. And this is one of the sponsors of the program. The Duolingo is another language program. And he says that language is more than a tool. It's an identity, a gateway, and sometimes a barrier. And really the same thing applies for a profession. It's more than a tool. It's an identity. And sometimes it helps. It gives you an opening to new opportunities. And sometimes it's a barrier. Here is another definition of professional identity formation. So it's a process which was mentioned already before, and it includes internalizing and integrating characteristics, values, and norms that lead to a new representation of self. So how you feel about yourself, what you think, who you think you are and how you answer that questions. Who am I? And ultimately, people will think, act, and feel like a physician. It may not be a physician. It can be really any other professional. But the idea is that you reach a point where you think, act, and feel like the profession that you're aspiring to. So let's look a bit at the differences or similarities between personal identity and professional identity. Of course, we all start with developing identity from day one or from when we are baby. And there are various ways that identity gets expressed, personal identity gets expressed. So, for example, this here is not just a nice tattoo, but it's from Maoris in New Zealand, and it also indicates the tribe that the person comes from, their background and their identity. So there are various physical characteristics that express who you are as a person. This here would be an Iranian family, so to stress the importance of family and community. I don't know whether it's really an Iranian family because this is just a picture from Google, but the idea is that it is your background that builds this personal identity. On the other hand, here we have some images about the professional identity. And obviously gloves, masks, scrub suits, and encountering patients. Some images that will come up if you think about a clinician, a physician. So we're going to use those symbols here, moving from one, maybe dressed up like you did when you entered a profession, when you applied for a professional career, professional training, to how you end up as what's your professional identity. And this is from an article by Lumen that was describing really the impact of COVID-19 on professional identity. And they studied medical students, how the impact that the pandemic had on their training, how it affected their professional identity. And as you can see, again, it is a process from initially professional identity seems distant, far away, starting out in the training, in that training path, until you maybe end up at the very end where your professional and your personal identity are totally intertwined, are almost totally intertwined. So I'm going to ask you now for a poll question. Which one do you identify with at this point? What level of integration at your stage regarding who you are? At what stage do you think are you at this point in terms of how your personal identity and your professional identity are integrated? And maybe we can start the poll now. Here's the poll question. So please identify on the computer. You can, it's a single choice question. Okay, so I can see that, let me see. Can you see the results?
Yes, we
Anyone?
can. Yes,
Okay,
yes.
great. So you can see, So between 20% and 70%. So in the middle, which is with the majority of you feeling that you are 50-50. And that might be actually a good way to be, because there could be some challenges if somebody has feels a 90% overlap. Let me maybe stop that at the moment. And let us think together. Okay, listen forward. Let us think about this a bit more. So it's a progression from little overlap to a lot of overlap. And since it's always in progress, it's not always a direct line moving up, but it can also be a reversal where you feel less of a professional and you feel for one reason or another to move back where your personal identity becomes more stronger, more pronounced in the way you feel about yourself. And what can be some of those situations where you move, where your professional identity becomes a bit weaker? Anyone can think of something? Please share your thoughts on in the chat, or just speak up. I can't see the chat, so I hope that someone else can read it.
Yes, dear professor, but doesn't any comments in the chat.
There were no comments. Okay.
Yes.
Well,
I'm waiting for that.
okay. Oh, maybe your group needs to warm up still a bit more. But
Yes, please.
just to give you an example, one of my colleagues, he has been a physician for several decades, working for a hospital and for a medical school. And at one point, really overnight, the hospital and his whole practice was closed down because the hospital went bankrupt. So his professional identity was very important for him to feel like a physician. He worked with many patients, and he was very liked among patients and so on. But then from one day to the next, he lost all his professional work, or a large part of it. So he kind of had to reestablish that he is still he had to reestablish his personal identity to make up for that void, that he was not getting that feedback about his professional identity on a daily basis. There were some comments in the meantime.
I think there is no, yes.
No comment.
No comment.
Okay, well, think also maybe in terms of if somebody gets sick and they are becoming a patient themselves, temporarily even, their personal identity may become more prominent at those points. So we need to think of this as something not always moving forward, but also moving backward. And the article by Luhmann actually was addressing how in the COVID situation, when much of the training became online, how that affected the progression to a more professional identity.
Excuse me, dear professor, I
Yes.
have one question. It's about the overlap between the personal identity and professional identity. When does it occur in this phase? We have very much overlap between those identity. How could it possible? For example, do you have any example for that? When the
Okay.
Professional identity, yes.
So, for example, somebody spends most of their time doing in their professional lives. This is actually a big issue now in terms of wellness and in terms of life-work balance. There's a lot of discussion about how people who are only devoted to their professional work, how they are not able to also attend to their personal life, and how that can be a problem if something happens to them and they fall ill, for example, how then they have lost the connections with their families or with their communities outside of the profession. So it's really a big issue that's being discussed. And I think that we also acknowledge that younger generations have much more sensibility for maintaining their personal identity, for not spending 20 hours in the workplace, but to also attend to their growth and their welfare in their private lives, in their life that is their personal that
Individual
build
life,
their
maybe.
individual life. Yes.
Yes. But Dr. Sudape said, I think the mismatch sometimes come from the differences between responsibility we have in the family and workplace. Is it true?
I'm sorry.
She wrote in the comment, she think the mismatch sometimes come from the differences between responsibilities we have in the family
Yes.
and workplace.
Yes. Yes. Definitely. I think that's a very good point. And
Yeah.
for example, if people get married or have children and there are other demands coming at them, just as much as the work demands, there can be a lot of conflict. And I think in the world of professionalism and thinking about how we can be professional in our work, this has become more and more acknowledged. The importance that it's not just professional to spend all the time at work, but it's also professional to have a balance between your work and your home life or your personal life, individual life. Okay. Thank
Yes,
you
thank
very
you.
much for the comment. It's a very good one. Okay, so we talked about these overlapping identities, and we talked about some of the things that will be important to have so much emphasis on the professional identity, but it also can be risky. Now, getting back to the theater play that I saw, and you see a picture here from the stage, the person with the red scarf is a teacher, and the others were the students. And one of the discussion points they had was that they all wanted to pass the English test, but there were many journeys to it. Everybody has their individual journey of getting there. And really the same also applies to the health professions education. So in the next few minutes, we're going to address some of the ways that training programs can help or maybe hinder some of this progression of professional identity formation. So this is Cruz and others. Hope you can see the image here. They developed an outline, a diagram of how this socialization process occurs. And of course, with education, we have an increase in competence, which will have an immediate effect on socialization as well. But the question is, how do we get from the existing personal identities to the integration of personal and professional identities? And so they postulate that with increased competence, there will be more socialization into these new roles or these combined roles. And therefore, this will help with this integration. And feeling that you learned something, that you know something now that you didn't know before, creates a lot of satisfaction and joy, and that will reinforce the socialization process. But there are other factors as well, and one is to learn the language of a profession and to live with ambiguity. They felt was also a very important step into the direction of becoming a professional, because many people enter the field of medicine or health profession thinking that there would be science behind it and everything would be clear, some clear answers to questions. But in real life, there's a lot of ambiguity in the healthcare field, a lot of uncertainty, and that is all an important aspect of learning to play the role of being a professional, as well as the learning, of course, that there's a hierarchy and there are power relationships. So understanding the social landscape of the profession. And there's also other factors that will influence the socialization, and that is a lot of anxiety, fear, and stress that comes with training, and also some loss of innocence that will affect the development. So this is just one of several ways that we can plot out how this socialization process occurs. And to demonstrate this a little bit more, well, first of all, yeah, there's some training programs. Of course, they have trying to impact this process. And in terms of curricula, ways that they are building into the official programming strategies to help with this transformation, as well as extracurricular activities. And I will focus more on the curricular efforts. There's, of course, clinical experiences that should help someone feel more like a physician. And there's also simulation and role models and mentoring. They are considered some of the key elements of what programs can do to help with this transformation to a professional identity. And we must not forget there are also extracurricular activities that can help, like clubs, volunteering, and attending conferences that will put you into the same space, virtual or in person, with other individuals who have the same type of professional identity, which will strengthen your own. But what generally is considered the key ingredient for all of this is that these experiences, that there is some reflection to it. The reflection is the path to growth. And I think the previous presenter also mentions the importance of reflection. So some schools have developed particular programs to facilitate reflection. And this is an example that I'm going to show you a little clip about of a medicine clerkship program that actually doesn't exist anymore, but it existed in 2001 when this documentary was made. And there, NYU, the New York University Medical School they had this program where once a week students would meet in a small group with a facilitator, and they would discuss their experience that they had in their clerkship, encountering patients, encountering other team members, and they would address the issues that come to their mind, how they process these experiences.
Leila and Dr. Mubina have some question about the language. Uh, she said, if I'm not mistaken, you mentioned that knowing a new language can provide some opportunities, and sometimes it may create some kind of obstacles. My question is that how can knowing another language cause possible problem? And Dr. Mubina said about that, yes, she exactly the same question, have the same question, and what problems may learning new various language have?
Okay, so I assume you're talking about language, not professional. Well, they're really very similar. As we discussed, if a language becomes more prominent than another language, then your communications with other people will be different. It will be enhanced if you're in a group with other people who can speak the same language, but it will be maybe more limited if you are with a group of people who are speaking a different language. So language is an issue that is forms our identity. I also have some references, and I think that will be put into the chat as well. One of the things that one of the references talks about from they related to the play is how there are some a language of the brain and the language of the heart. So sometimes it will become a language will help you understand. It will build your knowledge. That will be the language of the brain, and the language of the heart is how the language you use in order to express your feelings. So they can become very different, and one can belong to one language or to the other. So for example, in the clinical setting, you have the language of medicine, and that is your terminologies and the terms you use. But the language of your heart, the way is in a different language. It's in your personal identity. And so what that can result in that your feelings of empathy, for example, are diminished because you don't want to feel in a clinical encounter. You want to think about all the knowledge you have to apply to a clinical problem. So that could be one of the negative things that come from learning a different language. And it's really important for all of us to be aware of this potential discrepancy and to figure out a way to integrate it. Does that answer the question?
Thank you so much. Yes, Dr. Leila said thanks, and I think the question have resolved. Yes.
Okay, very good. So let's go to the video now. And as I said, please feel free to turn on the closed captions in order to be sure to hear what's being said, okay? That segment of the documentary is called Dehumanizing Patients, and I'm going to turn it on now. And I can repeat it if you like. Let's see.
Some of the residents, they use kind of derogatory terms towards patients when they're not around them.
It's just some patient who basically cannot do much, basically is bedbound on a ventilator, because really there's nothing that they can do for that patient, and there's nothing the patient can do for themselves.
And they refer to them how?
Go meet train wreck.
Gomes.
Trainer.
I think both.
Goma, you know what Goma stands for? Get out of my emergency room.
Ah.
And I think it would be really good to hear what your own response is to that. And maybe you want to talk about that? I don't know if you do, a little more fully, because then we could see what really goes into it, even for you.
Well, I just think it makes the patient seem less like a patient. I just don't think it's a very nice thing to say. I mean, it's not, outrageous. It's not some horrible, horrible comment, like the way that I feel about racism or something.
That's an interesting point.
I mean, I feel very strongly about it. I don't think people should refer to people as gomers. And in the position of a medical student, I don't feel comfortable saying anything about it at this point in my life. We're really at the bottom of the ladder, really. I mean, it's not like it's not something I feel comfortable with right now. But let's say at the level of an R2, I mean, I think that I would say something if I heard people saying it, because I think it implies that the patient is sort of somewhat. I don't think it's fair to criticize people on things they can't control. And I think that, being on a respirator, being really sick, and being unable to care for yourself, that's not something that you're responsible for. And even if you are, we're not there to judge, we're there to take care of patients. And I think I just sort of feel it's wrong, it's just my opinion.
I don't have a lot of responsibility at this point, but one day I will be in their shoes, and I'll be thinking, time's going to be an issue, and I can sort of see the other side of it and saying, yeah, gee, that person on the ventilator, which nothing happens with every day, that patient, why is that person here? What, it's sort of like, I'm not saying that I'm going to refer to the person as a train wreck, but, I gotta think, I try to see behind why people do that.
Well, I guess I'm wondering, is it okay with you if you call the patient names in your own head or to someone else, when actually it is a difficult system that you're contending with, and it dehumanizes the patient, at least in the view of several of you here?
And these are patients that, through whether it's fault of their own or not, are in a situation right now that require our help. I'm not there to judge them, and I'm not going to refer to them. I'd refer to them, this is a patient that has multiple problems, but I'm not going to be using terms that I wouldn't want to be called if I were in that situation.
I wonder what the rest of you think, whether using these terms is helpful to you, and if so, in what way, and if it isn't, what's wrong with it,
Like most of the people in this room are saying they wouldn't personally say something like that. So are we going to turn into those people? Maybe, I don't know, but...
Well, you're not helpless blobs of plasma. You are, after all, right? You have a capacity to make choices.
Okay. So I realize that we are running out of time quickly. So I will stop the slides here, and maybe we can just spend a few minutes thinking about what would you do? How would you respond to this comment about, is this how we will become? So let me stop the slides, and we'll adjust. I have more slides, but we can, I'm sure they can be sent to you. I think it's more important now to try to process this. So any thoughts? What would you say to that comment? Is this how we will become? And it refers to role modeling, which actually one of your colleagues has done a very nice study that maybe you were even involved in, about investigating the impact of good and poor role models that educators are, of course, very concerned about. And it's really the way we process these encounters with good or poor role models that will make a difference. But classroom pen pal system, so where students have to communicate with each other about how they feel, to express their experience and give an opportunity to reflect on it with their classmates. And that also helps with some socialization of them. But it's a complex issue. But maybe the previous speaker had also some thoughts on it.
Yes, we have some comments. One of our audience said, I think we need different role models for covering our different roles.
Yes.
Yes, and yes, just that one.
Yeah, it's definitely having multiple role models to aspire to or to reject. The good ones we want to people see as a way to become, and the bad ones we want to see have an opportunity to reject them. We don't want to become like them. So having multiple role models will be important, and it will be important for the to have an opportunity to reflect on that and to process that, like in those small groups that you just saw, where people were talking about residents using derogatory terms for patients and so on, what they don't want to become. But it's also important to have enough to of what good role models that they can use.
Yes, Dr. Sudabe said, I think we are highly affected by our environment. One of them is a role model.
I'm sorry?
One of them is a role model that highly affected by our own environment. Yes.
Yes. And of course, nobody is perfect. No role model is perfect. And we have to keep that in mind as well, that role model, somebody who may be appearing like a wonderful physician, a wonderful clinician, may have some bad days too. And so nobody is totally perfect.
Yes, that's right. And are there any question or comment?
Well, I know that we are already over time, so
Yes.
for you it's the evening, for me it's the morning. So you're in a different spot than I am. But well, we have this. I'm happy to share the slides. There's some more information on it and more things to think about. But it's been really a pleasure to be here, and thank you all for your attention to be addressing this issue. It's a complicated one, but an important one we all need to think about.
Yes, thank you too, dear professor, for sharing the information with us and having this conversation in this 1 hour webinar. Is it possible, can the audience turn on their cameras for having some memorial picture? Yes, and Ms. Sadeghi, could you please help us in this regard? Yes, thank you. Thank you so much. And yes, is it okay?
Well, maybe some of you having dinner right now.
Yes, maybe. But
Yes.
we are in the university right now, and some of our audience in their
In a
home.
car.
Yes,
Yeah.
yes, maybe.
In
Thank you so
public.
much. Thank you so much.
It's been a pleasure being here. And yeah, we have, maybe you can also share with the group the information about the conference, the call for proposals and for posters that we hope
That's
maybe
great.
some of you will put together. So thank you very much for the opportunity.
Thank you
We
so
give
much.
food for thought.
Thank
Okay.
you, Professor.
Thank you,
Take
Professor.
care,
Bye.
everyone.
Bye. Have
Bye-bye.
fun. Have fun.
Bye.